If you've been diagnosed with the condition of fibromyalgia, there are a number of things that you really need to know in order to make your life a little easier in terms of dealing with the symptoms, managing the frustration, and working through the inevitable pain associated with this condition. Now, patients today ask more questions and are much more skeptical about health claims and the diagnoses they receive from their doctors than ever before. Now, that's great news because people must become more proactive in their own health care. Unfortunately, they often fail to ask the right question, a question that could make a big difference in the quality of life and your experience with fibromyalgia. For example, they should be asking if there is anything else they should know about their condition that might help to ease the pain or speed their recovery or improve their ability to cope. You see, most doctors really are sincere in their efforts to help you eliminate your pain and suffering. However, many doctors view your condition from a very narrow and limited point of view, often to the exclusion of all others. The result is they frequently miss the mark on your diagnosis because they're either not looking in the right place or they're looking at the things they're trained to look at, but in the wrong way. An example of this is fibromyalgia. Most doctors view it as a contrived or non-existent disorder, in large part constructed on the part of the patient. And yet it's a proven fact that the vast majority of fibromyalgia has been caused by physical, biochemical, and emotional factors. It's also been proven that the mindset must be treated before the condition can be completely reversed. Unfortunately, most doctors begin prescribing an assortment of drugs, ranging from pain medications to antidepressants. Now, this places further strain on your health and doesn't even begin to address the true cause of the problem. The symptoms of fibromyalgia are similar to many other disorders. And while it's not clear exactly what triggers fibromyalgia, researchers are homing in on the basic mechanisms. Fibromyalgia is considered a disorder of pain regulation. Patients have higher levels of two substances, a nerve chemical called substance P and nerve growth factor in the spinal fluid. They also have lower than normal levels of the brain chemical serotonin, as is also true with people suffering from depression and anxiety. Now, all of this produces a dysfunction in the body's ability to process pain, and it creates supersensitive nerves throughout the body. To make things worse, people with fibromyalgia have difficulty getting a good night's sleep, so they constantly wake up feeling fatigued. The result? Everyday sensations of discomfort and pain are amplified beyond the norm. Doctors test these tender points to make the fibromyalgia diagnosis. Yet it's not always so clear-cut what the widespread pain indicates. Physicians are used to diagnoses like a herniated disc, where there's pain in a specific location. But that's not so with fibromyalgia. Some pain is above the waist, some below the waist, at the shoulders, etc. And there are sleep disturbances and fatigue. These are symptoms of a number of diseases. They are not isolated to fibromyalgia. The muscle pain can range from mild discomfort to severe enough that it limits a person's everyday life, including work and social activities. The pain is often described as burning, gnawing, throbbing, stabbing, and aching. When the person relaxes, the pain may be more noticeable and less so when they're active. Fibromyalgia means pain in the muscles, ligaments, and tendons, the soft, fibrous tissues of the body. Although the muscles hurt everywhere, they are not the only cause of the pain. Instead, the diffuse, body-wide symptoms are greatly magnified by malfunctions in the way the nervous system processes pain. The symptoms of fibromyalgia are unpredictable, and most patients are frustrated by their physical limitations and inability to make plans. You may feel as though you have to push yourself to get things done. Most patients with fibromyalgia say their muscles feel like they've been pulled or overworked, and sometimes they twitch or even cramp. Even the skin may feel badly sunburned. Every muscle in their body shouts out in pain. In addition, they feel devoid of energy, as though someone had unplugged their power supply. If you can relate to these experiences, and have experienced them for more than 3 months, then maybe it's time to ask your doctor about the possibility of fibromyalgia. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my fibromyalgia roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.